The reported concussion numbers and rates have increased dramatically across the last decade. As you can see from the slide, from 2007 to 2014, concussions treated in hospital emergency rooms for adolescent populations have more than doubled, with the greatest increases by far occurring for older teens compared to younger teens. When these numbers are converted to relative rates, that is, how many concussions for every 1,000 patients seen in the emergency room, young adults ages 20 to 25 have a concussion rate of 5.2 concussions for every 1,000 patients treated. Young teens between the ages of 10 to 14 years of age are double that rate at 10.5 per thousand, while 15 to 19-year-olds are more than triple that rate at 16.5 per thousand patients seen. It's possible that this increase might be due to increased participation rates. That is, if more kids play, you could easily expect more concussions. However, the Aspen Institute's 2020 report found that participation rates in youth sports for 6 to 12-year-olds was actually down in 2016 compared to rates from 2015 to 2008. So more kids playing is probably not the cause of this increase. On the other hand, awareness, identification, and reporting of concussions has improved substantially. We believe that this is the primary explanation for the dramatic surge in reported concussions. In fact, the rate reported is very likely underestimated since many concussions never get to the emergency room, either because they are not detected, go unreported, or they are treated by doctors and athletic trainers without referral to hospital emergency rooms. When we ask which sports are the riskiest in terms of likelihood of concussion, it's not surprising that contact sports place athletes at the greatest risk. This slide depicts a meta-analysis, meaning that the statistics were determined from multiple studies, not just one, and that to be included, studies had to meet a minimum level of judged scientific validity. To compare one sport to another, researchers determined the average number of concussions for every 100,000 athletic exposures. An athletic exposure is defined as one athlete participating in one athletic practice or competition, regardless of the time played. Rugby, hockey, and football lead the list, but even non-contact sports such as baseball and volleyball experience concussion rates of 6 or 7 concussions per 100,000 exposures. Not all youth activities were included in this study, and we know that other activities not included have some significant risks. Horseback riding, equestrian events, for example, have significant risks of concussions also. There's some evidence that girls are more likely to sustain a concussion than boys. We don't know why yet. It may be that the neck size and strength may play a role in absorbing the force of an impact to the head and neck, thereby reducing the likelihood of a concussion in boys compared to girls, based upon the greater size and strength of the boys. Let's take a look at some common misconceptions, some might call them myths, about concussions. Although our knowledge of concerning concussions has grown rapidly, there's still some common misperceptions about this serious, what we now call mild traumatic brain injury. So let's take a look at a few. Number one, loss of consciousness is the primary characteristic of concussions. True or false? The answer here is false. We know that loss of consciousness is seen in less than 10% of the cases. However, its occurrence usually provides clear evidence that a concussion has occurred. Of course, every loss of consciousness is not a concussion. People can lose consciousness for any number of reasons. But if a player takes a hit and loses consciousness, you can be pretty certain that a concussion has occurred. True or false? Children should be awakened after a concussion every 20 minutes for at least the first night. The answer? That's false. We know that rest and sleep are crucial for recovery. Simply touching a sleeping person during the first 24 to 48 hours is normally sufficient to determine if they're responsive. They need not be fully awakened. There is a difference between being unconscious and sleeping. If a person is unconscious, they probably would not respond to a slight nudge or touch. A sleeping child, on the other hand, will show signs of responding without being totally awakened by such a simple gesture. True or false? Helmets prevent concussions. Again, the answer is false. A properly fit helmet can prevent serious head injuries such as a skull fracture or a serious laceration. However, concussions occur when the brain moves inside the skull in the cerebral fluid. A helmet is designed to prevent external injuries but cannot stop the brain from moving inside the skull, which is the mechanism that causes concussions. True or false? Concussions only result from a direct blow to the head. Again, this answer is false. We know that concussions can result from a blow to the neck or the chest or another part of the body if that blow is strong enough to produce a whiplash effect to the brain. This movement causes the brain to move inside the skull, which is again the mechanism by which a concussion results.